Hello, this is Dr. Sivarajan Thandeswaran. I'm a stroke and neurovascular medicine consultant at the Kauvery Hospital. So I want to talk to everyone about stroke. Stroke is a leading cause of disability and death nowadays, and its incidence is increasing rapidly because of our changing lifestyle and increasing incidence of diabetes, hypertension, cholesterol, smoking and drinking habits. Stroke is a treatable condition nowadays. It's not like olden days where patients don't get treated and they are left to sort of be bedbounded most of the time. If somebody is in hospital which is stroke ready like the Kauvery Hospital, we can reverse the symptoms immediately with certain drugs and mechanical clot retrieval treatments. The main problem that lies behind stroke is poor identification of stroke and not reaching a hospital that has got all the facilities to treat a stroke patient. Universally, we have accepted FAST as a easy tool to sort of identify patient. FAST just stands for F-A-S-T, face, arm, speech and time. Face is heavily represented in the brain. So for example, a lot of our area in the brain which control facial movements are located along the motor strip along with the hand and thumb area. So anyone has a stroke, face is usually affected. And same way arm and speech is also affected, because as we evolved from being primates to humans, a lot of our brain has been taken over by speech area and facial area. So if somebody has facial weakness or asymmetry in the face, or one side of the face is lopsided compared to the other side, easy way is to ask them to smile or make a grin, and if there is asymmetry, then it is a clear indication that they are having a stroke. The next step is to sort of ask them to raise both hands, and if one hand is not holding up and it's drifting down, then another indication that there is a stroke. And if they are unable to talk clearly, say for example, it may be a slurring in speech, or it may be they cannot express themselves. If any three of them are present, immediately pick the phone and call Kauvery Emergency. There are other sort of minor features that could present like a stroke. For example, if your vision is slightly dimming away, which may appear like a curtain coming down and going up, or if you have a sudden onset headache, which has never been the case before, or if you have sudden onset dizziness or giddiness or loss of balance, then think of stroke, because these areas in the brain are represented in the back of the brain where the balance is controlled, and they can present with sudden strokes, which are very critical parts in the brain where the heart and breathing centers are also located. Traditionally speaking, strokes are of two types. 80% of strokes are due to clots in the blood pipes, which block off nutrition and blood and oxygen. And the symptoms start immediately. As soon as you are able to come to hospital, if we can use clot busting medicines in those with blockage in the blood pipes, we can reverse the symptoms, and I have treated patients who have walked home by day 2, day 3. And it also reduces the stroke burden if somebody's clot is a very large clot. At 3 months down the line, patients who had clot busting treatment are far more independent than those who never had it. And it's very important to know that the clot busting medicines can only be given up to 4.5 hours from the onset of the stroke. It is best if it is given early on, like half an hour, 1 hour, 2 hours from the onset. So you shouldn't be waiting until 4.5 hours to have it given to you. In selected few patients, we may be able to pass a catheter through the blood pipes and take the clot out if the clot buster is unable to unblock it. Same like what the cardiologists do to coronaries, where they put a stent and take the open up a coronary and help you from having a heart attack. The other 20% of strokes are due to a rupture of a blood pipe, which can be within the brain or it could be outside the brain. And those patients often are much severe in a clinical scenario, and they need immediate neuro ICU support. And at Kauvery, we have got a hyperacute stroke unit which covers both these areas. So this is what we can offer at the Kauvery Hospital, which is a stroke ready hospital, which is fully manned by trained stroke physician, stroke matron and trained neuro intensive care personnel, and fully trained nurses. I would also like to talk about what we call TIA, or mini stroke or warning stroke. So this is similar to what patients have in heart attacks. Before a major heart attack, often people develop mild angina. So same way, before a major stroke, majority of patients would have experienced mild symptoms like a numbness in the hand, or they may have dropped something, or they may have had a slurred speech, or they may have had difficulty in expressing themselves transiently, which may have come and gone over a 10-minute period to 60-minute period. And these are the patients who we have to catch early on, and if we can sort of give them the right treatment, we can avoid a major stroke. So statistically speaking, patients who had a large stroke have experienced a mini stroke in the week prior to this. So it's very important to be aware of this mini stroke condition and seek help as soon as possible. So we have a stroke prevention clinic at the Kauvery, and also post-stroke clinic apart from hyperacute stroke service. Thank you.